I'm just going to go through some of the fetal cardiovascular anatomy here. This is a key to your upper left. As you see, there's the placenta. These are some of the key features of the fetal cardiovascular system. Of course, the fetus is, of course, is in a completely fluid environment, and it relies on nutrition that's provided by the placenta, which is labeled 1. So this little key is from the Samson model of the fetal cardiovascular system, and some of these features will be labeled on the model as we go through the slide presentation. So this is a development that occurs during the embryonic period, during the time the fetus is developing. This is about at week 4, right after about 4 weeks of gestation. This is reconstructed with 3D imagery, which involves fiber optic utilization inside an 8-week embryo. As you can see, the head is visible with the arms, the hands, the feet, the little toes. All this clear fluid that surrounds the embryo is basically the amniotic fluid. You can see the umbilical cord in this view also. In that very first view on the left, this is an anatomical illustration of the buds in the eye and the ear. This is in the very first week, first 3 weeks of development in the embryo. So these are the fetal cardiovascular anatomy features. On the left is the fetal cardiovascular anatomy. You can see the placenta on the bottom. The umbilicus consists of the 2 umbilical arteries and the 1 umbilical vein. Remember, blood in the umbilical vein is being carried from the placenta to the fetus, to the fetal heart structures, okay? And then the umbilical arteries are taking blood from the fetus, from the fetal structures, and they're colored blue because they're deoxygenated blood. Always remember that the color blue refers to deoxygenated blood. The color red refers to oxygenated blood. You see the ductus venosus, which will become the ligamentum venosum in the adult. You can see the liver in the right upper quadrant of the abdominal cavity. Of course, the heart has a few features that are unique to the fetal cardiovascular system, and that is a foraminal valley. The foraminal valley is the hole between the right and left atrium that allows blood to go from the left and right atrium. So you can have partially oxygenated blood in both the right atrium and the left atrium. The pulmonary trunk will take the blood out of the heart, and there's a structure called the ductus arteriosus, the structure right here, and that allows for blood to flow from the pulmonary trunk to the aorta, from the aorta to the pulmonary trunk, and that allows for blood to be distributed to the lungs so that they can develop. So the ductus arteriosus is the communication between the pulmonary trunk and the aorta, as you can see from the figure. The ligamentum, the ductus venosus, is actually the umbilical vein taking blood to the inferior vena cava. And the ductus venosus will become the ligamentum venosum in the adult. Here's the inferior vena cava, right here. And here's the abdominal aorta, right here. So make sure you understand where these features are located: the aortic arch, superior vena cava, the ductus arteriosus, and know what adult features they become. So the ductus arteriosus becomes the ligamentum arteriosum. And then the pulmonary trunk, the pulmonary veins. Remember, pulmonary trunk will carry deoxygenated blood. The pulmonary veins will carry oxygenated blood in the adult part. Foraminal valley, that becomes a fossa in the adult. Ductus venosus will become the ligamentum. I should say the ligamentum venosum in the adult. Umbilical vein, umbilicus, umbilical arteries, placenta, and umbilical cord. Ductus venosus will become the ligamentum venosum. So here's the umbilical arteries, which are colored blue because they're carrying deoxygenated blood. Remember, they're carrying blood from the fetus to the placenta to be oxygenated. That's the reason they're colored blue or purple. And the umbilical vein is red. It's carrying blood from the placenta into the fetal cardiovascular system. So they're colored red. The umbilical vein, you have only one umbilical vein, and it's colored red. The ductus venosum will become the ligamentum venosum. And there's your model again, showing you the key in the upper left. Then here's a close-up showing you the foraminal valley, this little line through the interatrial septum. It shows approximately the positioning of the foraminal valley, which allows communication between the left atrium and the right atrium. And the diaphragm, inferior vena cava, ductus arteriosum, which basically allows blood, the umbilical vein, to bypass the liver and then enter the inferior vena cava. And this is just another view of the image from the models that are taken from the lab. You can see the pulmonary valve, these three little dots that you see in the upper left-hand corner of the heart. Those little three dots represent the cylinder valves of the pulmonary trunk. Okay. And this is development during the fetal period, where at this age the fetus is about month 5 in figure B, and in figure A it's at about month 3. This shows an illustration of the fetal heart anatomy, where you can see that use the colors red and blue to denote deoxygenated versus oxygenated blood. Here's the fetal heart on the left, where you can see the blood flow is with the directional arrows that shows you the direction of the blood flow. So as blood goes in through the vena cava, in superior and inferior vena cava, it goes into the right atrium, and it also has the open foramen valley. Remember, the foramen valley becomes the phosphovalus after birth, and then that allows for blood to flow from the right atrium into the left atrium. Okay, and then also you see the right ventricle taking blood going out the pulmonary trunk, and then it goes out that ductus arteriosus into the aorta. Okay, and then you can see the foramen valley being closed at birth, and then the ductus arteriosus will close at birth also, and it becomes the ligamentum arteriosum. And then you can see the 4 pulmonary veins, which are going to carry in the adult circulation oxygenated blood, whereas the pulmonary arteries are going to carry deoxygenated blood in the adult. So here's an illustration showing you the umbilicus with the umbilical arteries and the one umbilical vein. And just basically on the right, you can see the heart separated out in its chambers in the direction of blood flow. Okay. So everything that you see here in red on the left is your oxygenated blood, and everything that you see here on the right is your deoxygenated blood. And how that deoxygenated blood then has to be fed by the vena cava and the internal iliac arteries into the umbilical arteries, which take this deoxygenated blood into the placenta to be oxygenated. And once that oxygenated blood occurs in the chorionic villi in the placenta, then it's returned back to the fetus through the single umbilical vein, colored red because it's oxygenated blood. It goes back through the umbilical vein, and then the umbilical vein becomes the ductus venosum, and then it enters the inferior vena cava, and then it goes into the right atrium. Okay. Remember, the oxygenation process occurs in the placenta of the chorionic villi, because remember, the lungs are not operational in the fetal circulation. So here's your direction of blood flow in the fetal cardiovascular system, as you can see by the numbers. And these are the numbered labels correspond to the fetal cardiovascular structures. And here's an echocardiogram showing you the blood flow through the fetal cardiovascular system. The blue areas indicate deoxygenated blood, and the red areas indicate oxygenated blood. And here's a cadaver view showing you the heart and the fetus. This is the larynx up here, trachea, right subclavian vein, anterior vena cava, posterior vena cava. And here's the cardiac cycle that occurs in the fetal heart. And here again is the model again of the fetal heart anatomy. And this is a close-up view showing you the ductus arteriosus, which becomes a ligamentum arteriosus, the pulmonary trunk, the mitral valve, the bicuspid valve, also called the left AV valve, or atrioventricular valve, and then the pulmonary valve up here, diaphragm, ductus venosus, and the inferior vena cava. And this is just another close-up showing you the foramen valley, umbilical arteries, umbilical vein, which carries oxygenated blood. Remember, the umbilical arteries are going to be blue. There's two of them where the vein is going to be red because it's carrying oxygenated blood from the placenta. So here's your direction of blood flow. And the umbilical vein versus the two umbilical arteries. And here's the placenta.